So when you talk about quality of life, you talk about how the patient feels, what they feel in their life, because cancer is a hard diagnosis for people to have to go through. And we want to make that process as smooth of a transition for them as we can. If they're struggling physically, emotionally, they're also struggling. So if we can meet those needs and get them feeling better and doing well, their quality of life is going to improve and they're going to have a better outlook on life.
Every person defines quality of life a little bit differently. So when we're talking to a patient and they talk about quality of life, we try to find out what is the quality of life they're looking for.
Because sometimes at home they don't want to lean on their family. So sometimes they come in and they talk to us and tell us things that they wouldn't tell their family. Sometimes they have no one, so giving them that touch or a hug is the only contact they have with another person. And then just being able to smile and just know we're there for them.
When I think of these roles, they are patient support, patient advocate. They should be there to assure that the journey is seamless. Many of them don't work in the clinical setting. They may have some clinical background, but they really are there to support the patient. Are they holding their hand? Are they making referrals? Are they setting up transportation? There's many things that are going to be unique to each patient. And that's where that navigator comes in, is they navigate the patient through the journey. The clinical people provide the clinical care, and those navigators, whose term is very vague, but can be very important as we care for patients.
So as a social worker, I look at all of their needs. I look at their physical needs, emotional, social, and help them navigate those challenges. I have been doing social work now in oncology for about 25 years. And so I found a lot of good resources out there that they can be able to use to help through those difficult times.
I think just researching everything that there is and putting your knowledge in from working a lot of those years in there to give them everything that's available to them. I think that's important.
For centers who want to start a program or kind of don't know what their resources are, connecting with centers who have started it, job shadowing opportunities, talking to directors and leadership that are on board with this. We have to sell it to administration that there is value in these positions, because the value leads to quality and quality leads to better outcomes. And we have to get the right people in place to be part of that journey, and our patients are what really are to show for it.
I think that adding the patient advocacy role, navigation teams at all cancer centers is just a key to better patient care, because then we're taking care of the full spectrum, not just the physical needs and the health needs of all patients.
If you're going through a cancer experience or a cancer treatment, seek out that social worker, that navigator, that person that can really help you, not only through your treatment course, but even after you're done with your treatments, as you're going through survivorship. It's so important that once you finish your treatments, you know that those connections are still there for you.